Hi, in this video I'd like to talk about another patient case study, a recent one that I think is worth sharing. This patient has multiple pregnancy losses, ectopic pregnancies, biochemical pregnancies, and not a single successful pregnancy in her medical history. She spent over a decade trying to receive the proper treatment, and also due to the ectopic pregnancy, she's also left with only a single fallopian tube because the other one was ruptured. It had to be removed, and in her 10 years of seeking treatment with many medical experts, fertility experts, none of them could help her, despite their reputation in supposedly helping hundreds and thousands of miscarriage patients. Now, upon diagnosing her uterine morphology, her fallopian tube, upon doing proper diagnosis with her, immediately here at the hospital, we've seen the same thing happening over and over again. These IVF doctors and recurrent miscarriage specialists, none of them could diagnose what her problem is, and immediately we can already know what her underlying cause was that led her in these 10 years of pregnancy failures. Now, she is another distinct classic case of uterine malformation. She has another septate uterus that was undiagnosed. She also had a form of naive uterus that was undiagnosed, despite many doctors saying that there was no problems with her uterine shape and size. But here at the hospital, with over 40 years of experience in this field, we know that naive uterus and septate uterus would lead to high-risk pregnancies. It will be very difficult to have a successful pregnancy if these are untreated. However, many doctors are not putting the emphasis that it needs to have, not recommending corrective surgery to recover the uterine shape and size. Now, here at the hospital, we've already repeatedly stressed that a healthy uterine shape and size is very important for successful pregnancy. A healthy shape is an upside down pear shape. Now, you can diagnose this yourself if you go to your nearest radiologist and get a HSG done, a hysterosalpingograph. Now, if it doesn't conform to it, upside down pear shape, then you do have a form of uterine malformation and can lead to potential pregnancy loss. Many doctors don't know this, or they don't emphasize this. So for this patient, she could have saved 10 years of time. She could have saved the thousands of dollars that she spent, hundreds of thousands of dollars she spent in IVF and IUI and assisted reproductive. And she also could have avoided the ruptured fallopian tube. If she had this diagnosed earlier and treated, she could have already started her own family. So this video is to raise awareness before your pregnancy journey. Do a HSG and get a corrective surgery done. Here at the hospital, we do a corrective surgery within 2 days of operation, hospitalization of 1 week. If you have a septate uterus, a naive uterus, it's easily diagnosed and very quickly treated. We have treated thousands of patients with septate. Regardless of severity, it can lead to high-risk pregnancies and pregnancy loss. So we must put an emphasis on it. This video serves to bring that awareness. If you have a history of multiple pregnancy losses, biochemical pregnancies, ectopics, unexplained, no doctor can give you an explanation. It very likely is a potential septate or naive uterus that was left undiagnosed or probably no emphasis on. So get in touch with us via the website if you'd like to receive this treatment or receive this consultation. Let us explain to you how it can cause pregnancy loss and also arrange a treatment for you as soon as possible. Leave me a comment down below as well.